So all this to say that the severity of sleeping disorders can vary a lot. So one person can show certain symptoms of insomnia without necessarily suffering from an insomnia syndrome as I defined it. But what's important to understand here is that the strategies I'm going to present here are as pertinent if you have an insomnia syndrome or a lesser severity of sleeping disorder. Now, I'll speak of the prevalence of insomnia. Prevalence means how frequent this problem is with cancer patients. When I started to work on insomnia related to cancer in 1997, there were very little studies that had uh, looked at this issue, and that's surprising now that we see how frequent this problem is. In 2001, with my colleague, Dr. Morin, we published an article that showed that 30 to 50% of cancer patients or cancer survivors showed insomnia symptoms. Then in my research team, we tried to see in two studies what was the prevalence of the insomnia syndrome, what I just explained with the specific criteria in terms of frequency, difficulties, sleep efficiency, and so the most severe version. And what we noticed is that with the prostate cancer survivors, the prevalence was of 18%, and it was at 19% for breast cancer survivors. And knowing that in the general population, the prevalence of an insomnia symptom is usually between 9 and 12%, it shows us that insomnia is at least 2 or 3 times more present amongst people suffering cancer. A fact also that we saw in these studies is that they showed that insomnia was chronic in 95% of the cases, and this is defined by a duration of more than 6 months. So in 95% of the cases, insomnia problems lasted more than 6 months and sometimes even years. For studies that in our language we call are transversal, which is that we take a measure at one point, but it says very little on how the difficulties evolve during a longer time period or during the treatment for cancer. Uh, so more recently we did a longer study on 975 people who were waiting surgery for cancer to evaluate the prevalence of sleeping disorders during time. We followed people for 16 months. And majority, no, not the majority, but 48% of our sample of 975 people were people who were being treated for breast cancer, 27 for prostate cancer, and 12% for gynecological cancer. But we didn't distinguish if it was ovarian cancer. We grouped all the gynecological cancers together for this study. And other types of cancer were less represented. We had people who had an ORL cancer, a urinary or gastrointestinal cancer, and others that are less frequent. And what this study showed is that it showed higher prevalence rates than in the other studies. And the difference is that in the other studies I mentioned, it was often with people who had finished their treatment. So we noticed that during the treatment for cancer, the prevalence of insomnia is even higher. And what we observed more specifically is that in the weeks following the surgery, the prevalence of insomnia was at of about 29%. and that is all cancer types together, and that this prevalence was reduced progressively during time. Here, for those of you who have the slides, you can see that we have the data up to 10 months after the surgery, and we see that it goes down to 22%, which, as I mentioned earlier, is still 2 or 3 times higher than in the general population. And what also is important to see in this study is that if we put together the people who do suffer of insomnia syndrome with those who have insomnia symptoms, so who complain of having sleeping difficulties but without meeting with all the criteria for an insomnia syndrome, we see that the prevalency goes up to almost 60%. So it's almost 2 people out of 3 who in the weeks around surgery for cancer really show insomnia symptoms, and that's very important to note. And that is much higher than in the general population. We then looked at how the prevalence of insomnia varied according to the different types of cancers, and what we saw also was very interesting. Prevalence of insomnia syndrome is particularly marked in women being treated for breast cancer and gynecological cancer, whereas on the opposite, patients being treated for prostate cancer are at least 2 or 3 times less at risk of showing insomnia troubles. And whether we look at prevalence of the symptoms or the insomnia syndrome, the prevalence is more important for women suffering from breast cancer and gynecological cancer. And we'll see a bit later some of the reasons for that. Even if we don't really know the reasons explaining this difference, we will see some hypothesis around this to explain it later. In the same study that I just described, that was done with about 975 people who had surgery done for cancer, we looked at the sleep trajectory. The sleep trajectories according to the information we had. So how did the sleeping difficulties evolve in function to the different treatments they received? And an interesting factor to mention, good news, those who were good sleepers at the beginning, in the first weeks around the surgery, the most majority of these, the 68% of them, keep being good sleepers up to 10 months later after the first measures we took. What is a bit more worrisome is that those who show certain insomnia symptoms without having insomnia syndrome at the beginning in the weeks around the surgery, 6% of these will develop insomnia syndrome, and 12% will stay with insomnia symptoms at all the times. And this is worrisome because it shows us that when you start having insomnia symptoms or an insomnia syndrome, it has a tendency to stay on, and that is very worrisome. We also see that those who have an insomnia syndrome at the beginning, it's usually always in the weeks around the surgery. 51% of these will continue to respond to all the criteria, as I mentioned, of the insomnia syndrome at all the moments we took the measures up to 10 months after the first measurements. So we see that the sleeping disorders, once they're there, it's very difficult to get rid of them. I spent a few months on the team of Dr. Sonia Liezl from the California University in San Diego last year. And in the work I did there, we analyzed data that had been compiled with people who were receiving chemotherapy for breast cancer. And what we did in this study is that, first of all, we took the sleeping measurements before the beginning of the chemotherapy, and then we started taking measurements during the first cycle at week 1, week 2, and week 3 of the first cycle of chemotherapy, and then at weeks 1, 2, and 3 of the fourth cycle of chemotherapy. And every time the women had to wear an actigraphy, which looks sort of like a watch that the person wears on their wrist, and that gives us a measurement of their level of movement. So if we see through this apparatus that the person moves a lot, we presume that she's awake. Whereas if she's immobile, we will deduce that she's probably sleeping.